public health experts broadly welcomed the proposed measures. "This sounds to me like a very progressive and very needed move," said Professor Kozala Simon, a health economist at Indiana University, of the recommendations. But Paul Hanley, a New York lawyer representing local governments in a legal battle against opioid makers, said recommendations, while laudable, would be toothless without substantial funding. Opioids include prescription painkillers, heroin, and fentanyl. More than 100 Americans die daily from overdoses, according to federal data. The Commission recommended a national media campaign to encourage opioid addicts to seek help. Only 10.6% of people who need treatment get it, the report noted. The media campaign would encourage addicts to stop being afraid or ashamed of seeking help when facing their addiction. The Commission said drug courts, which are currently offered in just 44% of U.S. counties, should embrace medication-assisted treatment to improve outcomes. The U.S. Food and Drug Administration last week announced plans to encourage wider use of substitute opioids such as methadone and buprenorphine, which do not induce a high and are used to help people through drug addiction recovery. Still, Dr. Stephen Kurdish of the University of Alabama at Birmingham said communities often lack treatment facilities where drug courts can send addicts. And many drug courts charge fees that make them unaffordable for many. The report recommended expanding the ranks of emergency responders allowed to administer naloxone to treat overdoses. It also encouraged stricter prescribing guidelines for physicians.